All right, so we're going to be doing the abdomen and thorax evaluation. First, you would want to get your ABCs, so get your airway, breathing, circulation. Next, we're going to take a history, a past history, and a present history. Any unusual sounds, any signs of pneumothorax or crepitus, or any sucking sounds, any unusual sensations in the nerve or breathing problems. And then next, we would just do our regular inspection of swelling, discoloration, deformity. And then we would inspect any signs of abnormal breathing patterns, such as pneumothorax is when one lung comes up, and then any signs of shock. Next, we would want to see if they have a deviated trachea when your trachea is off to the side, and that could also be a sign of pneumothorax as well. Then we're going to see if they have any hematitis or hematuria. Hematitis is when you're coughing up blood, and hematuria is when you're bleeding, when you have blood in your urine. Then we would want to inspect the breasts. We would ask the patient, see if they have any contusions on their breasts. And then we'll also inspect the nipples, see if they have any heat rashes or anything like that. So for palpation, we'd start off palpating the clavicle. So we'd start at the shaft and then make our way to the SC joint and check the AC joint for any fractures, sprains, or luxation. Next, we would want to check the sternum, so the manubrium, the body, and the xyloid process for any fractures. Then we would want to check the ribs, so usually you do on both sides, but you go up the body, and then the costochondral joints, which is connected to the cartilage, and then the costosternal joints, which is connected to the sternum. We'd want to check for any fractures, luxation there. Do you mind flipping over? Okay. And then we'd also want to palpate the thoracic vertebra, which is the costovertebral joints, which is just the joints that connect from here to the sternum. We'll look for any signs of luxation there. Go ahead and turn back around. Okay. All right. And then knees up. And then after that, we would want to palpate soft tissues. So the pectoralis major, pretend palpate that. And then the intercostal muscles, it should be the muscles in between, like the drop where the ribs are. You'll be able to feel them like dropping. And then there's muscles in between there. And then the rectus abdominis. So you want to push down here on the, see if they have any pain there. Next, the internal and external obliques here. And then the abdominal quadrants. So we would go to the upper left, lower left, upper right, lower right. We'll check for any contusions and or internal organ injuries there. And then again, the breasts, we'll check for any contusions there. Next, for special tests, we would check here. We'll start with the abnormal rebound pain test. So we're going to press down on the abdomen, and they maybe have an initial pain just pressing down, but then sometimes they'll also have pain as it's coming back up. We'll check for any internal organ damage there. And then we'll compress the rib compression test. So you'd want to press down on the ribs here, see if there's any fractures in the rib. And then next, we're going to do forced inhalation and forced expiration. See if there's any external or internal intercostal strains. Go ahead and breathe all the way in as much as you can. And when you get there, breathe all the way out, all the air out. Perfect. And then for care sign, sometimes they would come in talking about a shoulder injury that can be, or complaining that their shoulder is hurting. That can be a sign of a spleen injury. And then McBurney's point, we basically palpate around where the appendicitis is, or the appendix is here. So we palpate about there. All right, next we're going to do range of motion tests, and we're going to do this actively and passively. Do you mind standing up? Okay. And then, so we're going to do trunk flexion. So go ahead and flex forward like that. Okay. And then extension, go ahead and go back. Trunk extension. And then we're going to do rotation. So just rotate your body like this. And like this on the other way. Perfect. And then next we're going to do lateral flexion. So we're going to go on the right side. You just want to go down like this. Okay. And then left lateral rotation. Perfect. Cool. Let's go ahead and lay back down. All right. And then so for trunk flexion, I'm just going to go ahead and put weight down as she's coming up and go ahead and do a sit-up. So go ahead and do a sit-up. Go ahead. Sit up, sit up, sit up. Perfect. And go ahead and go back down. And then next we're going to do trunk rotation. So go ahead and do another sit-up. Okay, and then just stay there. And then bend your knees. Okay. And then I'm going to add pressure here and go ahead and just rotate towards me. So rotate towards me, rotate there. Perfect, perfect. And then go ahead and do on the other side. Perfect. Go ahead and lay back down. So for trunk flexion, it works on the rectus abdominis, the internal and external obliques, transverse abdominis. For the trunk rotation, it works on the rectus abdominis and the internal and external obliques. Next, we're going to do trunk extension. Go ahead and flip over. And then put the other arm, yep. And then basically just do like a reverse sit-up. Just go ahead and raise your chest. Okay, so like that. And sometimes we would even press down on there too as you're doing it. So that works on the erector spinae. And then do you want to just flip over onto your left side? Mm-hmm. Flip over on the left. Face me. And then we're going to do the lateral flexion. So go ahead and just like lift up sideways. So yeah, right, left. Perfect. So that works on the ipsilateral flexors, extensors, and quadratus lumborum. You can lay back down regularly again. And then the respiratory muscles, we already tested that out as we're breathing in and out. That works on the intercostals and the diaphragm. So for neurological test, it's going to be for motor, we're going to do Beaver's sign. So we'll ask them to do a sit-up, and then we'll ask them I'll ask first if we can just see where the belly button is. But basically, if their umbilicus goes up towards them, that's a sign of like umbilicus damage or nerve damage there, or both. And then for sensory, we have here. So we have, hopefully you can see it fine, but T1 is where the arm is at the armpit. T2 through 3 is going to be between T1 and T4. The T4 is basically at the nipple line. And then T5 is between T4 and T6. The T6 is where the xiphoid process is at. So right there. And T7 through T9 is between T6 and T10. T10 is at the navel, basically where the belly button is. And then T11 is between the T10 and T12. And T12 is at the pubis above the inguinal ligament. And then for the blood flow test, we won't be able to do it here, but we would take that.